The axial CT through the thorax is on our plate today. I'm gonna scroll down from the T1 level to the very T12 level. I'm leaving these bone markings here for you so you can follow me, and we'll try to identify the most important structures which we have here. Well, you see now three radiolucid dots on the screen. They are the apices of the lungs on both sides and the trachea in the middle. As I scroll down, so we have four vessels on both sides of the trachea now. The two which are closest and more anterior to the trachea are the common carotid arteries and internal jugular veins. The arteries are closer to the midline and veins are in front and lateral to them. The big vessel just behind the common carotid artery is the subclavian artery. The subclavian artery, it branches off the vertebral artery as it approaches the outlet of the thorax. Well, we have some bright kind of artifact on the left side here, and this is the contrast material inside of the left subclavian vein. So these shadows here on the right and on the left, they represent the subclavian veins. Just behind of the trachea, but in front of the body of the vertebra, we have some grayish tissue, and this tissue is the esophagus. It's gonna stay at the same position in front of the vertebral bodies as it runs towards the stomach in the abdominal cavity. Well, as I descend down, you can see another particular picture. Now we have two vessels, the left and right brachiocephalic veins on both sides. So our subclavian vein, it joined the internal jugular vein and created these two vessels. They are slightly different. You see on the left, I see the oval-shaped shadow. This is because our left brachiocephalic vein lies more horizontally than the right brachiocephalic vein, which takes absolutely vertical course. And as I follow them, you see how we converge, creating the superior vena cava right here. The other three vessels, going back, the other three vessels just behind the brachiocephalic veins are our brachiocephalic trunk on the right side, the left common carotid artery, and the left subclavian artery. And you can see how they converge and continues with the arch of the aorta, which is right here. Some soft tissues appears just in front of the arch of the aorta and superior vena cava. This is the thymus. Well, as I go down, you see two arches now running around the trachea. On my left, here we have the arch of the aorta, but on the right side we have another arch. This is the arch of the azygos vein. And azygos vein, it enters the superior vena cava. At the level below we do not see any arches, but what we have now, we have the ascending aorta in front and descending aorta behind. The ascending aorta leading us to the left ventricle, and the descending one is going to continue down to the abdominal cavity. Another beautiful vessel appears here, and this is the pulmonary trunk, the lambda-shaped vessel, the pulmonary trunk itself, and the right and left pulmonary arteries right here. Close to the artery, this vessel on my left, this is the pulmonary vein, one of them. And as I scroll further down, you will see how this pulmonary vein runs to watch the left atrium and opens in it. This structure right here is the left atrium with 1, 2, 3, 4 kind of legs. These legs are the pulmonary veins as they enter it. Okay, let me scroll up again. to show you what else happens here. Just in front of the left atria, you can see in the origin of the ascending aorta, and you even can identify 3 cusps of our aortic valve. Do you see this tiny line in the middle which subdivides the orifice into 3 cusps? So here they are, the cusps of the aortic valve. Just below, and then the level of the pulmonary trunk, we have some tissues here which appear on the right and on the left. Have a look at these kind of triangular shadows here. They are auricles, the right and left auricles. These structures are the most superiorly located parts of the heart, and each auricle gonna lead to the respective atria. So you see how the left auricle expands now into the left atria, and if you look at the right auricle, you're gonna see how it expands into the right atria. Here it is, the right atria. And it's easy now to tell that just in front of the right atria is the right ventricle, and just in front of the left atrium is the left ventricle. You can see the thickness of the wall of the left ventricle and compare it with the thickness of the wall of the right ventricle. You see they are different. This grayish shadow in the middle is the interventricular septum, and between the atria and ventricles we have the atrioventricular apertures with some shadows of the valves in them. As I scroll down and as I leave the right atria, the 2 vessels appear. The round-shaped one is the inferior vena cava. We don't have superior vena cava any longer, but we have the inferior one. Here it is. And the other vessel, which is just in front here, this is our coronary sinus. They both come here to enter the right atrium, and we can look at them here. As I descend down, some grayish structure on my right. This is the right dome of the diaphragm. We have the liver now on our right, the spleen on our left, and this hollow organ between them is the stomach, which has some bubbles, the air in the upper part, as you see, and there are some contents like fluid inside as well. This vessel behind here is the abdominal aorta. Look at this grayish line which runs all around the organs. What is it? How do you think? This is our diaphragm, you're right. So we have the left cruise and right cruise of diaphragm on both sides of the abdominal aorta. They make like a loop, the aperture through which the abdominal aorta enters the abdomen. The radiolucid area just behind and lateral to the diaphragm, this split here, it is the costodiaphragmatic recess, the kind of empty space between 2 pleures. So in our deep inspiration, the lowest parts of the lungs, they enter this recess and may be found here. Okay, let me change the settings now to the parenchyma and scroll up to the level of the pulmonary trunk. Again, this level, and look at the trachea. The trachea is much better visible on the parenchyma mode. At the level T5, you see how trachea bifurcates. It divides into 2. And now we have 2 main bronchi in front of our eyes, the right main and left main bronchus. And again, you see the course they take is slightly different on the right and on the left. We have more horizontal direction on the left side and more vertical direction of the bronchus on the right side. These projections, protrusions on the right and left sides, you see now, they are the roots of the lungs. And What are the tiny dots and lines which we have in the field of the lung? These dots, they are vessels, the pulmonary arteries and veins. Is it possible to figure out what is one or another? Yes, it is. The arteries, they usually follow the bronchi. So if you see the bronchus close to the vessel, this vessel is the artery, the bronchial artery. And the vessel which is independent in the tissue of the lung, somewhere here or there, these are the pulmonary veins. If any pathological structure appears, how to differentiate the nodule from the vessel or from the bronchus? They use the special settings, the vasculature and bronchial tree suppression settings. Then vessels and bronchi just disappear from their view, and only pathological nodules become visible then.